Hi dear friends, welcome back to Curiosity. I am Dr. Mohsina. Today we will see a very important topic. It is about immune or hypersensitivity reactions. I am just discussing about the types and important examples in veterinary medicine, but not going through the details of diagnosis or treatment of each disease, and giving emphasis only to the classification of hypersensitivity reaction and the important diseases coming under each group. Excessive activity of adaptive immune system can lead to inappropriate immune responses, collectively called hypersensitivities. In general, inappropriate innate immune responses do this by triggering inflammation that leads to collateral damage to nearby tissues or organs, or by producing vastly excessive amount of inflammatory cytokines. Excessive adaptive immune responses, in contrast, can cause damage by multiple mechanisms. One simple classification divides these hypersensitivity reactions into 4 distinct types, and each type involves very different mechanisms. So let's see the classification. It is type 1 hypersensitivity mediated by IgE antibodies and mast cells, type 2 by IgG and or IgM antibodies and complement, type 3 by immune complexes complement and neutrophils, and type 4 by T lymphocytes. Now let's discuss one by one. First we will see type 1 hypersensitivity. Type 1 or immediate hypersensitivity encompasses IgE mediated responses to foreign antigens. These reactions may be minor and local or may be severe or generalized. In its most extreme form, type 1 hypersensitivity or allergy is expressed as a lethal shock syndrome called anaphylaxis. Anaphylaxis is an acute systemic manifestation of the interaction of an allergen called antigen binding to IgE or on mast cells and basophils. The antigen binding triggers the mast cell to release a complex mixture of inflammatory mediators including histamine, leukotrienes, kinin, serotonin proteases, cytokines, platelet activating factor, eosinophil chemotactic factors, etc. Now let's see the different examples of diseases coming under type 1 hypersensitivity. One is systemic anaphylaxis or generalized anaphylactic reactions, and there is urticarial reactions or hives of the skin and subcutis, and acute edema of the lips, conjunctiva and skin of the face, that is facial conjunctival angioedema. And these are the less severe forms of type 1 hypersensitivity. So these are the generalized form. Also there is some localized allergic reactions like allergic rhinitis, chronic allergic bronchitis, allergic bronchiolitis, pulmonary infiltration with eosinophilia, allergic asthma, intestinal or food allergies, allergic gastritis, allergic enteritis, eosinophilic enteritis, atopic dermatitis, and sweet itch caused by culicoides mosquitoes. So we already told that allergic bronchiolitis is coming under type 1 hypersensitivity reaction. So this is a localized hypersensitivity type 1 reaction. So this is an X-ray picture in a lateral projection showing allergic bronchiolitis. Also there is a ventrodorsal projection of allergic bronchiolitis X-ray image here. So these are the examples of type 1 hypersensitivity mediated by IgE mediated responses and IgE and mast cells. So that's all about type 1 hypersensitivity reaction. It will include generalized anaphylaxis and also localized allergic reactions. So now moving on to type 2. Type 2 hypersensitivity reaction occur when the antibody bind to antigen located on the surface of cell. This bound antibody can then activate the classical complement pathway resulting in cell lysis or phagocytosis. Many different antigens may trigger this cell destruction, but an infection in a genetically predisposed animal appears to be a major triggering pathway. And cross-reactive antibodies can develop during infections. These cross-reactive antibodies directed towards an infectious agent may also bind to normal tissue antigens and trigger antibody-mediated cytotoxicity. Pathogens such as Babesia or Haemobartonella, which parasiticize cells, trigger an immune response that destroys those cells as a part of protective mechanism. The most common manifestations of type 2 hypersensitivity involve blood cells. These include hemolytic anemia if RBCs are involved, leukopenia if WBCs are involved, or thrombocytopenia involving platelets. Under some circumstances, a cytotoxic attack on vascular epithelial cells will cause a vasculitis with local vascular leakage. So, cytotoxic attack can occur in certain circumstances. Now, let's see the examples of type 2 hypersensitivity. Bovine neonatal pancytopenia, immune-mediated hemolytic anemia, immune-mediated thrombocytopenia, pemphigus foliaceus, pemphigus vulgaris, bullous pemphigus, and myasthenia gravis. All this coming under type 2 hypersensitivity. So you can see images here. One is the pemphigus foliaceus in a dog. You can see the widespread crusted skin lesions, and this is the histopathologic view of the lesions of pemphigus foliaceus in a dog. So pemphigus foliaceus, bullous pemphigus, pemphigus vulgaris, all these are coming under type 2 hypersensitivity mediated by complement. And this is another picture. We can see bullous pemphigoid in a dog. Ruptured bullae are present on the foot pads and toes, and the right one shows the histopathologic view, histopathologic lesion of the bullous pemphigoid in a dog. So this is the type 2 hypersensitivity mediated by complement pathway, classical complement pathway. Now moving on to type 3, antigen antibody complexes or immune complexes deposited in small blood vessels fix complement in situ and cause acute inflammation. So activation of complement by immune complexes result in production of complement byproducts that are chemotactic for neutrophils. The neutrophils are unable to ingest the complexes that are stuck in blood vessel walls, and they release their granule contents in the tissue. These granules contain toxic enzymes that cause severe tissue damage. The most frequently affected sites of immune complex deposition are the joints, skin, kidneys, lungs, and brain. The location of immune complexes is largely determined by the route by which the antigen enters the body. Inhaled antigens give rise to pneumonitis, antigens that enter through the skin cause local skin lesions, and antigens that access the bloodstream form immune complexes that are deposited in renal glomeruli or joints. Clinical signs are therefore variable but may include fever, cutaneous signs such as erythema multiforme, and polyarthritis causing shifting leg lameness or painful swollen joints. The other signs of immune complex deposition include the signs like ataxia, behavior change, proteinuria, isostenuria, polydipsia, and polyuria, or it also sometimes show non-specific signs such as vomiting, diarrhea, or abdominal pain. Now let's see the examples of type 3 hypersensitivity reactions: membranoproliferative glomerulonephritis, hypersensitivity pneumonitis, vasculitis, periarthritis nodosa or polyarthritis nodosa, canine rheumatoid arthritis, plasmacytic lymphocytic synovitis, and idiopathic polyarthritis. Can see the picture of lymphedema in a horse. It is caused by the immune complex deposition leading to vasculitis. So this is an example of type 3 hypersensitivity. Caused by antigen-anti complexes or immune complexes. Then there are other type 3 reactions like purpura hemorrhagica of horses. It's a severe non-thrombocytopenic purpura that often follows a streptococci equi infection, that is post-strangles. It occurs when immune complexes of antibody and streptococcal antigen are deposited in the vascular basement membrane. So this is the purpura hemorrhagica in the muscle of a horse. It occurs like after the post strangles infection caused by Streptococcus equi, or sometimes after the vaccination also. This is another picture of purpura hemorrhagica ocular lesions in a horse. Anterior uveitis or blue eye is an immune complex mediated reaction that frequently occurs in the recovery stage of infectious canine hepatitis. So infectious canine hepatitis recovery stage have an immune complex reaction that is leading to type 3 reaction called anterior uveitis or blue eye. It results from the reaction of serum antibodies with uveal endothelial cells infected with canine adenovirus causing ICH. And similarly, severe equine recurrent uveitis is associated with immunologic reactions to leptospira or onchocerca. So that's all about type 3. Then type 4 reaction, cell-mediated immune reactions occur when antigen triggers type 1 cell-mediated responses. Multiple cytokines are produced as well as activated macrophages and cytotoxic T cells. The infiltration of mononuclear cells and the release of inflammatory molecules from these cells result in the pathologic process of cell-mediated immune reactions. The antigens usually responsible for the development of type 4 reactions include intracellular bacteria or parasites, some viruses, reactive chemicals, and in certain situations cellular autoantigens. So this is a cell-mediated immune reaction type 4. Mainly T cell mediated. Then the lesions commonly occur in the skin causing allergic contact dermatitis when the antigen comes into contact with the skin. Examples of antigens that cause type 4 responses are metals such as nickel and chemicals that may be on lawns or carpets. And this can cause contact dermatitis on the ventral abdomen of dog that lie on their ventrum on such surfaces. Now another examples of type 4 hypersensitivity, granulomatous reactions, lymphocytic choriomeningitis, old dog encephalitis, that is canine distemper, and allergic contact hypersensitivity, keratoconjunctivitis sicca, transplant rejection, tumor immunity, and autoimmune thyroiditis. So this is a picture of dry eye or keratoconjunctivitis sicca caused by an immune reaction type 4 that destroys the tear gland. It occurs in dogs with genetic predisposition in Cocker Spaniels. So that's all about type 4 reaction cause, that is cell mediated immune reactions. Antigen triggers type 1 cell mediated responses. Multiple cytokines are produced and as well as activated macrophages and cytotoxic T cells. So this is all about hypersensitivity reaction. So we already discussed the important 4 types of reactions. The type 1 that is mediated by IgE or mast cells, IgE antibodies and mast cells, and type 2 by IgG and IgM antibodies, that is antigen antibody reaction will activate a complement, and type 3 by immune complexes and type 4 by that is cell mediated, mainly by T lymphocytes, cell mediated immune response. So please go through the examples of different hypersensitivity reactions and memorize it. So that's all about today's topic. So if this video is informative and useful, please like it and comment your suggestions. And if you are if you have not subscribed yet, please subscribe and click the notification bell so that you get notified every time I upload a video. See you soon with another video. Thank you.